Telehealth Summit brought to you by the California Telehealth Resource Center. We're so glad you could join us for today's session on patient engagement and partnering during telehealth visits. I am Aislinn Taylor, the Training and Outreach Coordinator for the California Telehealth Resource Center, and I'll be the moderator for today's session. We do invite participants to turn on your video for a more interactive experience if you'd like. Today's session is purely for informational purposes, and the California Telehealth Resource Center has no relevant financial interest, arrangement, or affiliation with any of the organizations related to commercial products or services discussed during the Telehealth Summit. Before we begin, I want to review a few tips for the Zoom platform we're using today. At the top right of your Zoom window, you can toggle between speaker view, which will show you just the video of who is speaking, or gallery view to see all participants with the video turned on. Closed captioning is enabled. If you would like to view subtitles or running transcript in a separate window, you can access them via the live transcript icon in your Zoom control bar. Today's session is being recorded and will be posted to the CTRC YouTube channel next week. Lastly, please feel free to post your questions in the Zoom chat window. We'll hold some time in between to take a few breaks for Q&A. And with that, I would like to introduce our speaker for this session, Raymond Barret, CEO of the Telehealth Certification Institute. Raymond is a licensed professional counselor and an expert telehealth consultant. Ray's passion for telehealth emerged from his experience as a clinician seeking practical, high-quality telehealth training. Since 2014, TCI has delivered telehealth training and consultation to a global network of more than 26,000 healthcare professionals. TCI offers 90 courses, a vast array of telehealth resources, and ongoing free continuing education opportunities for telehealth providers. Thank you, Ray.
Thank you. Glad to be here with all of you. So I am going to be presenting on patient engagement and partnering during telehealth visits. I have a lot that I'd like to cover with you. I won't be able to cover all of it, but I also look forward to a lot of the discussion and Q&A. So think about questions that you have for me and put those questions in the chat, and I'll get to as many as I can. So what I'm going to cover is the what, the why, the how, right, of patient engagement and partnering, and then the process, what that looks like. And then we're going to look at the pre-treatment engagement, the during treatment engagement, and then the post-treatment engagement. You probably know a lot about this already, but hopefully this will give you some additional information. So for one thing, patient engagement, what is it, right? There was an article posted in 2013. It's Patient and Family Engagement, a framework for understanding the elements and development interventions and policies. So I'm taking from their definition. This is the only time I'm going to read something, but I want to read their definition. They define patient and family engagement as patients, families, and their representatives and healthcare professionals working in active partnership at various levels across the healthcare system, direct care, organizational design and governance, and policymaking to improve the health and healthcare, right? But beyond that, what I want to share with you is what is it that patient engagement looks like, and what does it look like when a patient is not engaged or partnered? So these are some things to think about. And when a patient is engaged, I think they understand their diagnosis and they accept it, right? They've partnered on the treatment plan. They agree to it. They understand that treatment plan. They're interacting with the technology that the provider has made accessible to them, right? So if you're offering them to use apps and a client portal, a patient portal, those kind of things, are they actually using it? And then they're active in their own treatment, meaning they adhere to the treatment plan. They're looking at self-care. They're reading their treatment notes or their medical records. And then they're actually engaging with the clinicians during treatment. So it's pretty obvious, right? So someone that's not engaged or partnering in their own treatment, they might not really understand their diagnosis, might not truly, accept it. They might be very passive, just tell me what to do, tell me what's wrong, tell me how to fix it, and might not actually be following through with things like not showing up for appointments, not really engaging with the technology, all those kind of things. So, we're going to get to, it's important to kind of track some of these things. So as an analogy, one way to think about these things is, are patients a passenger in a plane, right? Or are they a co-pilot? Right? So the patients that you're working with, are they really co-pilots with you in that whole treatment creation and process and post-treatment? All right. So the next thing is why? Like, why is it that you want patients engaged and to actually be partnering with you in treatment? And do you actually want them partnering with you and engaged, right? So why is it? And what are those outcomes that you're looking for? So these are more questions just to really critically think about for yourself and your organization. The other thing is how. Exactly how is it that you want patients to be engaged and partnered with you? Okay. And then how is it that you're going to have that happen? Now, you might be like, well, Ray, those are like super obvious questions to ask. Yes. But when it comes to motivation and following through on things, we're not going to do it, right? As people, we're not going to be engaged, partnered, activated, motivated if we don't have a very, very clear sense as to the why and the how, right? So as an organization, I think it's important to really critically look at that. So another thing is, what's the difference between patient engagement and partnering when you're doing same location visits or treatment? I call it same location visits or treatment. What that is when the clinician and the patient are in the same room as one another. Okay. I don't call it face-to-face or in person or in office because I don't remove my face for telehealth. I'm still in my person. I'm still in office, right? So I call it same location for, for sake of the terms. But what's the difference between patient engagement in that situation versus when the clinician and patient are not in the same location, right? So basically T-E-L-E means from a distance, right? So telehealth, anything done remotely. But before, interactions between patients and providers was, you have to go to the office, or you have to call, or you have to fax, or you have to go and get the paper record and stuff like that. Now, as we all know, telehealth is really greatly expanded the ability for people to interact and be engaged. Now, with patient engagement and partnering, another thing I want you to think about is really good for business companies, right? Because for-profit companies, it's so important for their customers to be engaged. They want their customers to be constantly coming to them, looking for things, right? They want to be that resource for their customers. And how do they do that? You look at Google and Apple and Walmart, you name it, Best Buy, whatever, these big companies. And how are they doing it? They're using technology and AI. They're really understanding their customer individually, and they're feeding information in a way that's convenient, in a way that they are receptive to, in a way that is relevant to their customers. So in healthcare, are we doing the same thing? And a lot of healthcare companies they're super innovative. They really look at this stuff and consider it, rather than saying, hey, we've done these things this way, we've always done it that way, and we're going to continue doing it that way. No, they're good companies that really look at patient engagement partnering are really doing that data research and innovation to meet people where they are. All right, so another thing is the process, right? First of all, things typically don't get done. Ideas don't get actualized unless someone's responsible for it. Okay. So I'd say this is just basic project management stuff. But if we're going to take patient engagement and partnering seriously, we ought to really have a project management process for this. So who's going to do it, right? So having a committee that is committed to seeing this follow through and being effective and having those metrics is really important. So creating that plan, defining that why, that what, that how, and then defining what metrics are needed. Okay. So some of the metrics needed to be effective in this is metrics on our patients. Like, who are they? What are they wanting? What are their preferences? And who do they usually collaborate with, right? Partnering. Again, you look at Google, Microsoft, Apple, whatever, Walmart. They partner with other organizations, right? They're bringing other organizations resources and products and stuff like that. They're partnering with the other organizations that their customers love, right? So who are our customers? Who are our patients? And then what resources are needed for good partnering and engagement? What are the possible obstacles? What training is needed? If people are not trained, if they're uncomfortable, they're going to be hesitant, they're not going to engage, they're not going to trust. So we have training for the staff, but then also training for the patients in a way that's receptive, that meets the digital and health literacy needs. And then the implementation, right? Actually implementing, which we'll talk a bit about here in terms of the pre-treatment, the during treatment, the post-treatment process. And then how are we doing with this, right? So you have the evaluation process, and what metrics are you going to need to evaluate, and what are you going to evaluate? And then looking at a improvement plan. Patient engagement, patient partnering, it's not a one and done, right? We know that. Anyone who's in a for-profit business, so it's a constant understanding how the customer base, right, the patient base is changing and evolving, and meeting their needs is really important. So constantly looking at improvement. All right. So a big piece of using technology for partnering is privacy and security, right? We talk about trust. If people don't feel like the technology is going to really uphold their privacy and security, that's going to be an issue. If it doesn't uphold privacy laws such as HIPAA, that's going to be a problem. If you work in a school district, school system, you have FERPA law. So there's quite a few things to consider in terms of the privacy and security of technology that's used. And this sometimes is a challenge because, often the convenience of technology that's really convenient and familiar, that patients are familiar with, aren't necessarily going to meet the HIPAA requirements that you have. So that could be a challenge, but it's really important to uphold both. And technology just keeps improving for us in those ways, right? All right, so now I'm going to touch upon, before I touch upon pre-treatment, actually, let me just pause and see if there's any questions as of now that have come up before I move forward.
No questions in the chat box yet, but if anybody has any questions at all, please write to us throughout the session.
All right, excellent. Yeah, so think about those questions, put them in chat. Love to answer them for you. So pre-treatment, before you even see the patient, right? Before they come into your office, how do they get there? Marketing, right? So your billboard. So if we want people to be engaged with us, the marketing has to be real nice, right? That's what people, companies spend a lot of money on and so forth, to really make sure that it's relevant, it's speaking the language and has meeting the needs of the customer. So in terms of marketing, you have the website, brochures, signage, the publications, social media, emails that are sent out, phone calls that are made, text messages, secure text. You have the client portal, that's part of your marketing. So the marketing, you probably seen, we all see marketing all the time, right? So we're not going to be engaged with that marketing if it's not really attractive, really compelling, super easy to understand, but also answers all the questions that you have about whatever it is that you're seeking, right? The treatment you're seeking. If the most worrisome thing is the unknown, right? So getting those answers, those questions answered is really going to set people at ease and draw them in. And then again, partnering with other organizations, it's really hard to just market yourself, right? Having other people market you market them, adds that confidence throughout the marketplace. And on the marketing, another thing that's important is allowing patients to get to know the organization, to feel like they know the organization and the clinicians that they're going to be seeing, right? Uh, might be a horrible analogy, but if you think about online dating, right? If you're in online dating, you want the other people to be engaged with you, right? Well, how do they do that? Well, they start to get to know you before they reach out to you. So similar, like we want them to get to know us, right? Get to know the clinicians so that they're going to want to engage. They're going to be interested. And then there's other things like such as self-scheduling, getting all the information they need and so forth. So basically that the marketing is a big piece of that. So that ought to be a part of the puzzle when looking at patient engagement. The other one is cultural competence, right? So in terms of the marketing, is it culturally relevant? Is it in the language of the patients, using the terms that they use? Is it providing the resources that are important to that community at that time? Do you have clinicians on staff that look like and sound like and so forth that represent the culture of the patients? And then the mediums of communication used for treatment, are those the mediums of communication that the communities actually use? So all of this cultural competence stuff, is very pertinent. People are going to be drawn to, obviously, and partner with, engaged with organizations that they feel like they can really relate to, right? Birds of a feather stick together. We see that in society all the time. All right, so the other thing is, so for the pre-treatment, some considerations that you could have is to have a pre-visit call or meeting, or what you would call a tech check or a client orientation, right? So that before the treatment, before telehealth treatment, right? Telehealth treatment, before telehealth treatment happens, having that pre-visit, however you want to call it, where it prepares patients for the visit will greatly help. Okay, if people are frustrated, they're not sure, if there's barriers you didn't know about, it's not going to happen. It's not going to work. So some organizations will use care coordinators, right? Intake coordinators. Some will use cultural navigators, peer support specialists. A lot of different roles will help patients who are seeking treatment to make sure that the process goes nice, smoothly, it's going to work for them, all these kinds of things, right? Another thing about pre-treatment is think about any business meeting you have, any meeting you have with coworkers or whatever. If there's not an agenda for the meeting, if it's like, oh, we're going to have a meeting at this time, and you look at your schedule and there's no agenda for it, are you going to show up? You might, if you're responsible, but sometimes it's been shown that people are much more likely to show up for appointments if they know what the agenda is. Okay. And if the agenda is meeting their needs. So making that clear, what is the agenda for the visit? Sometimes, I ask people, why are you going to the doctor? I'm not sure, but right. So having that clear. And then when the appointment is scheduled, asking the patient, what format do they want the visit in, right? Do they want a video meeting, a phone meeting? Do they want to come into an office? How is it that they want that visit to happen? Now, of course, the telecommunication modality needs to be applicable for the treatment that's going to be provided during that visit, of course. And then you want to ensure that the patient's actually able to attend the session, right? So do they have access to the technology? Do they understand how to attend? And then discovering any obstacles, right? So you ask them, so can you tell me, how is it that you attend the session? Like, let them tell you back, right, how it's going to work for them, and ask them, are there any obstacles for them attending the session, right? And then another thing is, if we want them engaged on particular technology, have them get engaged on that right away in the beginning. So like, let's say a major part of your patient engagement and partnering is for people to use a patient portal. Then you want that to be like the expectation, like, of course you're using the patient portal if you're a patient of ours, right? So when the first request comes from a patient or a referring party, ask, have you gotten on our patient portal? No, let me get you on the patient portal now. Okay. Do you have a device, even a smartphone? And you walk them through to make sure that they actually get on at that initial step before treatment even happens. And then if they have any obstacles, of course, you're going to walk them through, but you're going to let them know why. Why would I want to get on that patient portal? And if the staff is not motivated and enthused about the patient portal, they're not going to display that. So all the staff throughout the whole process, right? The intake coordinator, the person at the front desk, the clinician themselves, the discharge planner, they should all be like on board with this. So being able to explain, it's, our patients find it so helpful with the click of a button to look at their treatment notes, with the click of a button to reach their clinicians. And it's okay to reach out to your clinician. They want to hear from you, right? Those kind of things is really going to make a difference. All right. And then with the registration process, gathering information about the patient before they're even seen, that will empower the clinician to engage with them. Right. So think about a meeting that you're going to have business wise or whatever, right? You're going to look that person up. Every single meeting that I have with my business, I look the person up first, right? Look at their LinkedIn profile, et cetera, to understand them. Why? So that when I meet with them, I'm able to immediately connect with them, right? So you're not going to go looking up patients on social media. That'd be a violation of privacy. But during the intake, the registration process, getting information about them so that the clinician does know more about them to be able to partner with them, right? Excellent. And then connecting with their other providers to get medical data and partnering with their other medical providers, right? That's how we get that care coordination process going. Right. So then the environment, we don't want an environment like this, okay? So when patients are attending treatment visits, we need them to be in an environment that's really conducive, okay? So in all of this depends upon obviously the treatment that's being provided, but they might not know how to do that. They might not think about it. They might not even be in their mind. They're like, listen, I have an appointment. I'll just pull up my phone and voila, I'm in an appointment, okay? So during that intake process, it's helping the patient identify the most conducive space for the telehealth visit that they're going to have, right? And so you want to ask them, do they have a space that's private with the doors closed, where they're not going to be interrupted or distracted, right? Where they have good internet, good device, right? Those kind of things. You ask them if they have those environment, and then you ask them, well, can you tell me what environment do you plan on using? Because part of the emergency management plan too is you ought to know where the client, where the patient is, what their address is in case there is an emergency anyway. But helping them create that environment is really important. All right, so the next thing we're going to move on to, before I do, let me just check in real quick. Any questions that have come up so far before I move into during treatment engagement?
I'm not seeing anything in the chat yet, but don't be shy, guys. We're ready for them. All
right, sounds good. Yeah, so during treatment, right, when the patient's in the treatment process, so some considerations when selecting technology for patient engagement partnering. There's some really cool, great technology out there, like, Google's coming up with 3D video conferencing. Wow, how awesome. But your patients are not going to have multiple cameras and the devices to be able to do 3D with you, right? They might be able to see you in 3D, hopefully in the short future. But you want to find out what technology is a fit for them. What are they using in their daily life? It needs to be technology that they're familiar with, that they already have access to, that they're using regularly, right? So that takes a little bit of, getting the data. And then on your end, the clinician using quality tech. There's nothing worse than being on a bad phone call where you can't hear each other, or it's really granular and it's just really bad tech, right? Or hard to use, frustrating, doesn't have the capabilities that you need. So using high quality tech makes a very big difference. And then configuring that tech so that it's going to be really user friendly. Okay. So you find out from your staff and from the patients, what obstacles, like what problems are we having? How can this be better? And taking the time to get those things fixed so that it's extremely, extremely user friendly, right? And then having tech that's already integrated and compatible with technology that patients are already using. Like say you're in a school system, right? They get Chromebooks at school. Well, is the school allowing that technology to be used on their Chromebook, right? If people are just using smartphones or whatever it is, making it compatible with devices, browsers, and so forth. And then having a backup plan for technology failures. Not everyone usually thinks about this. Sometimes people think, well, what's a really good video client, meaning video conferencing program to use for healthcare? And then they, have that. But what if that goes down, right? Like I heard a big company just went down recently. So what's the backup plan? Okay, it's always good to have contingency plans for those that are really convenient. And then, you want to assess if the clients are comfortable with using the technology, right? And let patients know how to get the most out of the technology. So like, as an example, before we started this presentation today, we went over with you, listen, put it in speaker view. Here's the chat button. Here's the closed captioning button, right? So letting people know how to get the most out of it, like with video conferencing, hiding your self view and, being able to maximize the screen, all these kind of things. And then with documentation, right? You want to document if there was any issues that took place. Right, so technology, there's some supportive technology that we can use. So some of the technology that people are using now is messaging. There's all sorts of messaging on patient portals. There's secure messaging apps. There's like secure texting, secure chat, those kind of things, secure email programs. And then there's video, and then there's voice only. Again, the client portal, social media. But then there's also using mobile apps, extended reality, remote monitoring, digital therapeutics, which goes through the rigorous process of FDA approval, like pharmaceuticals. There's consolidated apps, which I love, like some of these really big telehealth companies. I don't need to mention the names. They have what I would call these consolidated apps or platforms where you have your records, you can connect with your clinicians, you can collaborate with other providers, you can use these really cool applications for self-care, all these kind of things, right? All in one place, so they're not having to use different platforms. And then in terms of the patient portals are kind of like the home, right? The home. And they're fantastic for communicating with patients, communicating with collaterals and other providers, scheduling, payment, self-management tools, surveys, evaluations, data collection for analytics, and access to the records, right? We're all, familiar with the information blocking rule that we have in place. And, patients have always had the right to their records as of HIPAA law, right, in 1996. So giving them that easy access to the records is really helpful. All right. So the other piece is rapport. So during the actual visit and treatment, having good rapport with patients, that's when you're going to connect with people, right? There's research on this. So how is it that you do that? How do you build rapport when using technology? So we all know how to do it, without technology when you're in the same room as someone. You can think about those things. It's mirroring with your body language, good eye contact, leaning forward, facial expression, paralanguage, all these normal things, good listening, being empathetic, all those types of things. With video and phone, we have to do the same thing, but there's some things we ought to consider, right? So one thing in general is just, again, to get to know the client before patient, whatever term you use, customer, get to know the patient before the visit even happens, right? And then to take notes during that intake call, right? What's important to this patient to be addressed? Who are they mentioning? What are the names that they're mentioning, et cetera? And then when you first have a visit with them, letting them get to know you a bit, you get to know them a bit personally, right? So finding ways that you could connect and relate to one another. It's right, if you've been to these social events, breaking the ice, icebreaker activities, those kind of things, it doesn't take long at all. Just knowing a little bit about each other breaks that ice so people are more comfortable. And then, of course, that active listening and attending and showing that you're really interested. Now, in terms of using technology, yeah, sometimes when people are in camera or audio, they don't get across that facial expression. So actually, in my own family, not last week, but the week before, we had 2 telehealth visits with 2 different physicians, right? In both times, sorry that I'm still doing the screen share, I didn't mean to be. Both times, this was the view that we had of the physicians. I'm not kidding. 2 different physicians, both times. And the first time I'm like, okay, they just don't know. The second time with a whole different physician, I'm like, are they doing this on purpose? What's going on here? So yeah, using the facial expression, paralanguage over the phone, letting people, being monotone and so forth is not going to be very friendly. If you're the clinician where you're like, give me the facts, I'll diagnose you. This is a treatment plan. Like, I don't want to call you back, right? It's not going to happen. And having good eye contact, right? So when you're on video, of course, that's looking at the camera. And there's a lot of tricks when doing video for that. In terms of these clinical skills, at our institute, we have all sorts of courses that go into depth in terms of the environment setup, setting up the technology, how to do these skills in a way that works really well, and how to help the patient get set up so that they know how to do it well, right? And depending upon the service that you're providing, being able to see them and hear them really well and all those things is really important. So how to coach them through that is a big piece of it. All right. So another one is, are any of you going to be like partnering with anybody that you don't trust? Who wants to partner with someone they don't trust? Like, no, thank you. Right. So trust is a huge part of it. And what makes us trust a healthcare provider? Think about that. What makes you trust a healthcare provider? Okay. Of course, getting a referral and knowing their credentials, but being professional also, like, do they show up on time? Right? Is the clinician, right? Is the clinician in a private location? Right? So if I'm using a virtual background and I don't show you my office, how do you know that I'm in a private location? You have no idea. I could have my whole family behind me eating dinner. Right? Verifying the clinician's identity, being transparent with them, right? Upholding all of those same standards of care that you would, not dressing in your jammies. I can't tell you how many stories. I mean, we've trained over 30,000 clinicians, and stories of the clinicians standing up and having their boxers on and stuff like that. It's wild. So just these basic professionalism, right? The other thing is, you're not going to be so trustworthy if the clinician's really unsure and uncomfortable with using the technology, right? So the patients are going to feed off of the comfort level of the provider, and then giving clear expectations, right? Because if you're fearful of how's this going to go, what if I can't use the technology, right? You're not going to trust the process very well. All right. So another piece of this is respect, of course, right? Anyone want to partner with anyone who doesn't respect them? Like, if someone just kind of feels like they're bigger, better than you, you don't want to partner with them? Anybody? No, heck no, right? So you want to show that we're equals, okay? I respect you. I care about you, okay? So showing that compassion, empathy, understanding, being affirming, especially when it comes to the use of technology. What do you mean you can't find the button? It's up there in the top right. Now in the navigation, right? Or in the address bar, type in. No, like if you're frustrated with them, if you're condescending with technology, forget it, right? So validating validating that, yeah, using technology can be really tricky sometimes, especially when it's new technology to you. I can understand that, right? Being patient with them and asking them for feedback of their experience. Like, if you respect someone, that means you care about how they're experiencing being with you, right? So asking for that. And then being culturally competent, cultural humility. Cultural humility is like, yeah, there's so much I don't know about you that I'd like to know, right? I want to understand your culture, how it is that you perceive and understand your illness and what's going to help you get better, right? Rather than, this is your illness, that's how you get better. How do you understand your illness? How do you understand the way that you might get better with this, right? All right. And then involving others in their life that provide them support, right? So working with kids, maybe having a parent there and so forth could be really helpful. So the other thing with like working with kids, or not even just kids, but sometimes involving other people, the other people that are with them, the supportive people in their life, can help you keep the patient engaged in partnering with you. Sometimes people don't want to tell you that they don't agree with the treatment plan, but their partner will say, hell no, they're not going to do that. Right? They're not going to do that. You're telling them to do 50 push-ups a day. Not going to happen, right? You're telling them to take this medication. Let me tell you, they don't take medication, right? Or they don't have transportation, or I don't know where they're going to find a computer to do telehealth with you. Like, so, and then just with kids, like having the parent guardian there, really, it's really about helping those with the patient, helping the patient actually be engaged in the treatment, right? Especially when you like evaluating, doing physical exams and all that kind of stuff, having someone there to help you, to facilitate that process. The other thing is patient education. So like, let's go back to the plane analogy. Okay. If you're a co-pilot, how can you partner as a co-pilot if you don't know where you're going, if you don't know how you're getting there, if you don't know how the plane operates? How can you partner, right? So people need to be empowered with really being educated about these things in order to partner, right? So it needs this education. First of all, if they're not educated by their providers, they're going to go look somewhere else, right? So if you have a condition going on in your family, you go on the internet, right? And the information they might get might be inaccurate, might not be totally accurate, might lead them astray, stuff like that. But if that's all that they have available, that's where they're going to go. So providing them accurate information in different formats, people learn differently, videos, audios, written, whatever, that allows, that also meets the digital and healthcare literacy needs that patients have, is really important. All right. So the other thing about that is, if this stuff is boring, like if I'm boring, hopefully I'm not, maybe I am. You're not going to be listening to me, right? It's boring, right? So it needs to be entertaining. Okay. It might sound like this is healthcare. Why do we have to be entertaining? Well, if it's not, they're not going to pay attention. They're not going to partner. That's just human nature. Okay. So the marketing, the education, all those kind of things really ought to be entertaining. So that might require having a, graphic designers, copywriters, videographers, all that kind of stuff. But you don't have to do it yourself. Right now, there's so many companies that are doing all this stuff for us, right? So it's just utilizing other people's resources where they've been there, done that, and they've created it in a way that's just awesome. And then the treatment planning, obviously, being clear, what is the treatment plan? Do they agree with that treatment plan? What are some other options? And then have them repeat it back to you so that they're really understanding it. Okay. All right. Before I move on, let me just check if there's any questions.
Hi, Ray. So we have a few coming from a language service provider who works with the limited English proficiency population. As a clinician, what do you see being the biggest issues facing the patient experience? Are there any anecdotal stories you can share along those lines? And what are some best practices?
Um, so, the technology just keeps evolving and changing all the time, right? So just going back to the basics, if people have to use new technology that they're not familiar with or that they don't have access to, then it's not going to work, right? So I think the main thing is having it readily, like easy access and convenient to them in a way that's just super easy is what's important. So like now where it's integrated right with the EHR on a tablet a tablet that goes from room to room. I've heard of people using uh, Apple computers because when you're doing the language interpretation, it's like you have three people, right? So you have the clinician, you have the client, and then the third person. So it's really more of like a conference room setup. So having a conference room mic, right? Having a mic that picks up everybody's voice super clearly and that the speakers could project really clearly. If it's sign language where the video feed is really clear. So I think that the technology that's selected itself is really important. But I don't have situations. I know myself when I was doing that with hospitals with telehealth, we were trying to do it. And this is way back when, okay. But this is just an example. We were doing it where I was remote, I was doing telehealth, the patient was in a patient room, and we would use the speakerphone. That did not work out well. It was okay, but you couldn't hear crystal clear. So then I said, forget this. Let's just do a three-way call. So then we used the language line where we did a three-way call. Now all three of us are on a phone and it was crystal clear. So yeah, I think just that audio and the microphone and speaker clarity is super important also. I don't know how much that helped, but.
All right, for our next question, we're asking, are there any strategies you have found that are helpful for engaging unresponsive patients and partners when all the communication is remote? The patients very.
Oh yeah, unresponsive patients. Did they say patients and something?
Patients and partners, so maybe some.
Oh, yeah, when patients and partners are both not responding. Yeah, that makes me very curious. First, my curiosity is, would they not be responding if they were in your office, right? So, the first thing I think of there is speaking to the elephant in the room, right? So rather than just continuing to push forward, speaking to it, say, how are you feeling with the visit today? Do you feel comfortable in the setting that you're in? Do you feel comfortable with the technology? Is there a method that you think might work better for you? Do you feel comfortable sharing what it is that you want to talk about today at this time? So yeah, I like speaking to that and finding out what it is that's going on there would be important. Some people might not want to tell you that English is not their primary language. They might not want to tell you that. Whatever it is, they might not want to tell you that they're not in a private setting because that's the only setting they have. So, yeah.
Yeah, it's a fair point. I think it really depends on the situation and trying to figure out what the reason for that unresponsiveness is. So the next question is asking, they're wanting some insight on how healthcare organizations support clinicians to encourage patients to use their medical record and useful strategies for getting clinician support, it sounds like.
Okay. Yeah. So, so a few things. So I think the question is, hey, how do we get patients to use the patient portal? Right? Yeah. All right. So number one, the staff needs to be, this is great. I know how to use it. It's easy, right? I love it. It's helpful to patients. All the staff need to be on board with that, right? First of all. And then patients need help. They need to be handheld. So from the very beginning. And then if they don't get on the patient portal in the very beginning, everyone's checking in with them. Have you gotten onto our patient portal? No. Oh, well, let's do that now. So you help them, you handhold them and inform them as to why use this patient portal. Let me show you. Let's send your first message to your clinician right now just to say hello, right? So I think those kind of things, that process is really helpful. So when people feel like they're going to be intrusive to their clinician, taking up too much of their time that they're not going to be reimbursed for, if they're unsure how to do it, if they don't know why to do it, they're not going to do it.
Agreed. So next question is something I've kind of dealt with in talking to a lot of clinicians is patients having a preconceived notion of telehealth being due to COVID pandemic and having this like bad connotation with it. Oh, we have to do this because of coronavirus. Now I have to see my provider this way. How do you dispel that negative connotation?
Yeah, so I would say it all has to do with, well, not all. Okay, I think the way to shift that is so that every person, first of all, you're marketing, but then every person in your organization that patients interact with, they speak about it in a way like, you won't believe this new thing we got. Everyone loves it. It's awesome. You're gonna love it. Let me show you, right? And I know I'm exaggerating, but they're like, oh yeah, I guess you can do telehealth then. Like, what? Like, who wants to do that? Right. But if it's like, well, you could do a video session from the comfort of your home, it's patients have found it to be so helpful to them and convenient. They love it. They keep doing it, right? Something like that. So the way it's communicated, I think, makes a huge difference.
Yeah.
For sake of time, I'll move on with some content and then we'll see where we get with that. All right. So another one. So in terms of during treatment, we have two categories for telecommunication mediums. And we have asynchronous and synchronous. You all know this. So asynchronous is not real time. It's store and forward. You create something, send it to them where they can experience it whenever they want. That's messaging, that's apps, all sorts of apps. There's apps for mood tracking, cognitive behavioral therapy, for depression, relaxation, for couples to do homework between sessions, for pain management, apps all over the place, right? There's a lot of research on them. And then, if you're working, say, with behavioral health, you can do crafts, worksheets. There could be online forums. You can send video clips, audio clips, digital therapeutics, right? There's a lot of really great asynchronous means. You see in schools, with school therapy, they'll have these interactive slides where you can click on any of these objects here and it will take you to a different place, so it's speaking to the audience, right? And then you have synchronous means. Okay, that's real time. You experience the communication at the same speed as if you and the other person were in the same room as one another. Okay, so with that, some ways for engagement, like for behavioral health, there's a lot, using more than one camera. Like, let's say I wanted even not for behavioral health, using a second camera sometimes comes in handy. Let me see if I have that. Yeah, let's see. So like I can, you still see me, but you also see me writing to you, right? Or I can draw, right? So if you wanted to show a client, patient something using multiple cameras, you could have a camera that has like the wide angle view so they can see your whole space. So if you have to demonstrate, say, physical therapy or OT or any of that kind of stuff, you can. There's whiteboards, right? So like, I know that Zoom here has a whiteboard, and I can actually use a little tablet here where I can draw with this tablet. I'm just drawing really quickly, but let me show you what this tablet looks like. Oops, that's not what I wanted to do. So this is a tablet I'm using, right? Just a writing tablet. So there's some tech that, peripherals that can be helpful there. And then in terms of the virtual background, I know a lot of people use virtual backgrounds. Personally, I think like just your normal, like not using one is best. Like they should be able to see your office, right? However, if you're going to use a virtual background, I think it's good if you use one that has an intended purpose. So say I'm meeting with a kid and during intake, I find out the kid's favorite toy is dinosaurs. He loves playing with dinosaurs or Legos or whatever. That could be like, whoa, look who I brought with me today, my friend T-Rex, right? So if it's a way to create engagement or connection, then like, yeah, makes sense. Otherwise, I don't know. Unless you're actually using a blue screen or green screen. But, the technology, I guess it's just a matter of preference. There's a lot of options out there for these things, and things just keep getting better and better. You can share apps, like you can share docs and sheets and slides and all this kind of stuff with video conferencing. But if you're going to do so, be very careful with privacy. Really know what you're doing. Don't just share your whole desktop or screen. You want to share the particular application. The other thing is people don't have to be, static in one place. They can move around. If it's a private location, even outside, they could use their body work, dance, yoga, breathing exercises, regulating activities, drumming, all this kind of stuff. They can do show and tell, show you things that are in their home. There's a lot of props. So like if you're working with kids, like especially for behavioral health, Legos, sensory toys, using books and all sorts of things. A lot of people use pets, right? Either on the patient's end or on your end. Sometimes that is the biggest icebreaker because, you're like this doctor, professional person, and I'm not sure I could relate to you or you could relate to me because I just drink beer with my buds in the backyard. I don't talk to docs, but you bring your bulldog in. Now we're connecting, right? But it depends upon, right, the client. You want to make sure that the patient's comfortable with that first, right? But sometimes people will come back just to see that pet, right? And then depending again on the type of treatment you're providing, like if you're doing OT or behavioral health or whatever it is, sometimes gamifying it, playing games. There's also all sorts of online games that people do. And then just coming up with games, right, that you can do while you're online. The other thing about during treatment is to find out, are patients engaging or are they not? And how do you know whether a patient is engaged and partnered with you or if they're not, right? So there was an article in 2018 where it talks about the patient health engagement model, PHE model. And they talk about these developmental stages of patient engagement. And it ranges from people like not accepting their diagnosis at all to the fifth stage where they accept it, they're engaged, they're partnering, they're taking ownership and all that kind of stuff. And they have a very, quick, easy assessment to find out, is the patient engaged and on what level are they engaged? And then according to the level of engagement, there's a certain response to help them become more engaged. Okay. All right, so I'm going to touch upon post-treatment. One thing that's really important here is open notes, right? So we want to provide the notes, let them know that they're available, show them their notes, review it with them. I mean, say you're partnering with someone on a project, but they're the only ones, only they have access to the documentation on the project. You don't get any access to it. How engaged are you going to be a partner? How are you going to feel like you're partnering with them, right? So really giving them access to that is really important. All right, so let me open it up for a couple of questions.
Hi, so it looks like in the chat we have, it's really nice to see people engaging with each other. I see some questions about how to encourage staff who are not comfortable with the technology. And for me, I think it's just continue to provide that education and support. And it's good to see you, Ray, being so engaged and enthusiastic about it. And I think that's something you just got to continue doing until people get comfortable with it. But do you have any advice?
Yeah. So, well, yeah, in the just like you said, that the training, so if people feel like they're not adequately trained, I think people are not going to like it if they don't feel like they can handle it. It's like you have to use this tool, but you really don't know how to use this tool. Like, you're not going to want to do it. But if you've done it, 15 times, you've actually done it 15 times with someone who's there with you that can walk you through it, make sure that you're really comfortable with it. That's going to be a different experience. So yeah, I think it's the training, not being like, okay, I gave you, go watch this video, or we gave you this one training. Some people need a lot more training than others.
Mm-hmm.
Yeah.
Definitely. And then being that patient engagement is such a broad topic with many components, is there any kind of way you would recommend to measure patient engagement, like a standardized survey or tool?
So there's the one that I mentioned, which I can give you the reference to that. The title of that is, it's Spotlight on the Patient Health Engagement Model, PHE model. Again, that was in 2018 that was published, and they have an assessment model there. But what I would do though is you want to think about, how is it that you want patients engaged? Okay. So you can say, on a scale from 0 to 5, how well do you think you understand your diagnosis? On a scale from 0 to 5, how much do you agree with the treatment plan that you have? Right? Have you used, or how many times have you used the client portal in the past month? Right? So those kind of things. How connected do you feel with your clinician? So I identify, how is it that you want them engaged, and then base and I've just come up with 5 questions, 4 questions, or whatever it is. It'll let you know, yeah, is the client engaged or not? And if not, we really need to address that.
Yeah, agreed. I found surveys to be a helpful tool for feedback. Always nice to hear from patients directly.
Yeah, and then using your the technology you have, a lot of that should be automated. So you should know, how many messages have they sent through the portal? Have they registered on the portal? Have they had any missed appointments? How often are they coming to their appointments? Those kind of just automated metrics where you get the analytics on your EHR is really helpful. So one last slide I want to show while we can continue on with questions is, here's our contact information. So we do staff training. So if you have staff that are hesitant or unsure, they don't have the really great skills of setting up their virtual office at a location outside the office, or using the technology, or they need training on the ethics and all sorts of things. If you need staff training or consultation, that's what we're here for. That's what we do, is telehealth training and consultation. And this is where you can reach us. Our website is telementalhealthtraining.com. And yeah, we have a couple more minutes for questions if we have them.
Okay, thank you, Ray. I'm not seeing any new questions. So I know we're getting towards the end. If you don't mind, I think we have some slides to share, Ray.
Sure. And if that's all, it was great being with all of you. Thank you so much for being here, being a part of the summit. And I really hope to meet some of you and connect. Definitely email me and reach out. I love meeting other telehealth providers.
Definitely. Thank you, Ray. Before we adjourn today, we just want to take a moment to recognize Kathy Chorba, who recently moved on from the CTRC. We're so grateful for her 9 years of service leading the CTRC. She had over 20 years of telehealth experience and program development. Her dedication to telehealth and the CTRC and the relationships she built along the way were a value to all of us. If you need any support from the CTRC, please feel free to reach us at caltrc@ochin.org. And thank you all for joining us today. Thank you.